Our work is mostly in low and middle income countries. We have 4 centres in Asia, 3 in Africa and 4 in Latin America. And one of the things we're most interested to do is increase capacity to deal with NCDs. So this is people, institutions, leaders and communities. Because at the moment there are quite a lot of people who know how to deal with communicable disease and maternal and child health, but people working on NCDs have been very few and far between up until now. And it's very important to increase that number and increase their capabilities in order to counter this pandemic. One of the biggest challenges we face, because we have many research programs in low and middle income countries, is how to scale it up, how to move from this being a research program that works in one community to something that works right across the country or right across the region. What is the solution to scaling up? I think this is a hard question that lots of people around the world are paying attention to, and part of it lies in understanding health systems, strengthening health systems. There's a science to it, which I think we're slowly but surely beginning to understand. But a second part of it is to work with government. I think it's very tough for people who are not part of government to create a really large-scale program. So learning to work with government is very important. The message I'll take home from the Geneva Health Forum is about partnership, how important partnership is. I knew that to some extent before I came. I mean, the mantra for countering NCDs is that it should be whole of government and whole of society. But that's easy to say, but how do you make it work in reality? And I think I've seen some ideas here on how we can begin to make that happen.